Hi, my name is Dr. Megan Crute, and I am a board-certified dermatologist with CallonDoc. Today, I want to discuss a few acne myths and facts regarding some alternative treatments and whether or not they're actually effective for treating acne. So the first one that I want to address is the use of honey to treat acne. Honey can actually be used for several different conditions in dermatology. We know that it has some natural antibacterial properties as well as some anti-inflammatory and antioxidant properties. The important thing to know about when you potentially want to use honey to treat something is in order to get all of these beneficial properties, you really need to look for a product that is labeled as raw. So it's unprocessed and unheated, because if it is processed and heated, it loses a lot of those properties that we really want in terms of treating a skin condition. So in essence, yes, honey can potentially be helpful for acne. Now, it's not going to cure it, but it may be helpful to help reduce the inflammation of some larger, more irritated or inflamed lesions, so the larger red pimples and pustules. So it's something you could consider trying if you wanted to spot treat areas like that. Definitely you want to use caution if you have any known sensitivity to bees or any bee products as well, but something you could potentially give a try. The next one is whether or not something like a diet or juice cleanse might be helpful for acne. And really, I don't think there's much evidence to that. Most of the time, those cleanses are only for a few days to a week or so. And even if there's some short-term benefits of it, really, acne is a long-term problem. And unfortunately, a short solution like a fast or a cleanse is not necessarily going to reset everything that's contributing to acne. So it commonly takes 4 to 6 weeks of any particular treatment to even start to see a difference with any acne overall. So I would not recommend cleanses necessarily as a great treatment for acne. Now, diet is the third thing I want to discuss, because there are some truths behind some dietary triggers for people. So throughout the studies that they've done regarding diet and acne, a few things have been shown to potentially cause worsening of acne for patients. And those two main things are diets that are high in a lot of carbohydrates, so high glycemic index diets, so more processed foods, pops or sodas, candies, sugars, things like that can definitely worsen acne. So we do recommend in people who want to take a more dietary approach to minimize processed foods, minimize added sugars, try to use more natural whole foods. So, fruits, vegetables, more whole grains if you are going to eat carbohydrate-based foods, and otherwise kind of meat, beans for proteins, things like that. The next thing is the effect of dairy on acne, and dairy can definitely worsen acne in some people, and it's mostly low-fat dairy, like skim milk, 1% milk. We don't see that effect as much with more high-fat dairy products like hard cheeses, yogurts, things like that. So those might be worth considering, trying to minimize the low-fat dairy in your diet if it seems like that's something that you ingest a lot of. It might be contributing to your acne. And in that same realm, frequently we can see patients who use whey protein supplements. They can definitely have a significant flare of their acne using those supplements if they're sensitive to the dairy proteins, because that whey protein is very concentrated. So those are just a few kind of alternative things for acne where, raw honey might be useful for a spot treatment. Fasts or cleanses are really not going to be a great long-term solution, but adjusting your diet to be lower in processed foods, lower in carbohydrates overall, and potentially lower in low-fat dairy products might be helpful in order to get a little better control without using prescriptions, or in conjunction with using prescriptions to get a little bit better result.